Hello, welcome to Optimal You, your nutrition guide. Today, we're taking a pharmacist's look into an ancient remedy that's getting a ton of attention from modern science, Nigella Sativa, or as you probably know it, black seed oil. We'll be exploring what the latest human clinical trials are telling us about its benefits, and, this is super important, how you can use it safely and effectively. Now, everything we're talking about today is based on some really rigorous scientific reviews, the kind that pulls together data from a whole bunch of human studies to give us the clearest picture possible. So here's what we've got lined up: a quick look at its history, then we'll jump right into what the clinical trials are saying. After that, we'll get practical and talk about crafting a daily regimen. Then, of course, we have to cover safety, super important, and we'll finish up with the final pharmacist's takeaway. All right, let's get into it. All right, so what's the actual science saying about this traditional remedy? Let's take a look at the hard evidence. I mean, just look at this illustration from the research. It's pretty amazing, right? The potential uses are incredibly broad. We're talking about effects on pretty much every system in the human body, and that's exactly why scientists are so fascinated by it. Okay, so what makes this seed so special? Well, what's really fascinating is that a lot of its power can be traced back to one single powerful compound, thymoquinone. We'll just call it TQ for short. You can think of TQ as the absolute star of the show here. It's what's behind most of the therapeutic properties we're seeing. But here's the big question, the one a lot of you are probably asking. Does it actually work for really common conditions like high blood pressure or diabetes? That's the million-dollar question, right? So let's see what the data says for these specific metabolic issues. Okay, so when it comes to hypertension or high blood pressure, the clinical trials are pretty clear. They found that both the black seed extract and the oil brought down both systolic and diastolic blood pressure, and did so pretty significantly. We're talking a noticeable reduction compared to a placebo, which is exactly what you want to see in a study like this. And that consistency carries over when we look at metabolic syndrome and type 2 diabetes. The results are really quite impressive. The trials show improvements across the board. We're talking better blood sugar, better cholesterol levels, and better insulin resistance. And one study even identified a specific dose, 2 grams of seed powder a day, as being sort of an optimal amount. Okay, so knowing all that, how do we translate this from the lab into our actual lives? Let's talk about building a practical daily plan, looking at this from a pharmacist's perspective. All right. One of the first things you have to decide is what form to use, and this is an important choice. The research suggests that the oil seems to be better for lowering that bad LDL cholesterol, but, and this is really interesting, only the powder form was shown to help raise the good HDL cholesterol, so a bit of a trade-off there. So what about dosage? Based on what we've seen in the clinical trials, these are the typical ranges people are working with. For the liquid oil, that's about 1 to 2 teaspoons a day. If you're using capsules or the powder, it's about 1 to 3 grams. Now, if you have a specific goal, like blood sugar control, the research really seems to zero in on that 2 to 3 gram daily dose, usually split up throughout the day. And a good piece of advice is always start low to see how your body handles it. Let's be real, the taste can be strong. So to make this something you can actually stick with, here are a few simple tips that can make a huge difference. You can mix the oil with something like honey or yogurt or even juice to help with that taste. Also, taking it with a meal can really help minimize any potential stomach upset. And finally, be sure to store it properly. Keep that oil in a cool, dark place away from sunlight to make sure it stays potent. Okay, and now we get to what is without a doubt the most important part of any of these discussions: safety. This is absolutely crucial. We have to talk about the precautions. And right off the bat, I've got some really reassuring news for you. You know, a common worry with any supplement is what it might do to your liver or your kidneys. Well, the great news is that multiple human trials have shown that at the recommended doses, Nigella Sativa did not have a negative effect on liver or kidney function. So, what about side effects? For the most part, they're pretty mild. The things that get reported most often are things like a bit of nausea, some bloating, or just general digestive discomfort. And a lot of the time, just taking it with food can help manage that. But, and this is a big but, it is not for everyone. It's so important to know this. If you are pregnant or nursing, if you're on blood-thinning medications like warfarin, if you have a bleeding disorder, or if you have low blood pressure, you absolutely must talk to your doctor first. Seriously, this is non-negotiable. Okay, so let's pull all this together and look at the key takeaways from a pharmacist's point of view.
The bottom line is the evidence is really quite promising. We have human clinical trials that are consistently showing that Nigella Sativa can have a positive impact on key markers for metabolic health, things like blood sugar, blood pressure, and cholesterol.
And this quote from the researchers really sums it up perfectly. They're saying that the effects on blood sugar, lipids, and even as a bronchodilator have been studied enough that they're ready for the next phase. We're talking about new clinical trials or even drug development. That is a huge vote of confidence from the scientific community. So yes, it's a powerful plant, and the research is definitely compelling. But the most important question is still, is it right for you? And the only way to answer that question correctly is by having a conversation with a qualified healthcare professional who knows your whole health history. For educational purposes only, this content is not medical advice. Always consult with a qualified healthcare professional or doctor before starting any new supplement, diet, or health regimen. Optimal You is not responsible for any actions taken based on this video.